It's 8:47 in the morning and I'm finally home from my shift. Honestly, I probably should be sleeping right now, but there's just one patient that I can't stop replaying in my head. I think that's one of the strangest part about this job is that sometimes you leave the hospital, but part of your brain just never really leaves with you. Tonight, it was a patient's breathing. I heard it before I walked into the room. Not full stridor, not respiratory failure, just very loud breathing. I guess the kind of breathing that really changes the atmosphere in the room. For a brief history, the patient was transferred to our hospital with a known esophageal mass with airway involvement. Head and neck surgery as well as ENT had already accepted the patient for possible definitive airway management. And honestly, when I walked into the room, the patient was stable. Didn't seem to be hypoxic, but the monitor was reading 130 phenobarbital. Patient was still awake, still talking, still protecting his airway. Oxygen saturation is above 92 on minimal oxygen. So naturally, the rhythm became focused. Started on amiodarone drip, continue to watch his pressures, continue to watch his oxygenation. Stable. No major concern. But something kept bothering me. The breathing didn't match the room. And I've learned not to ignore that feeling anymore. That quiet moment when your brain says something about this doesn't fit. So I pulled up the CT scan, and that's when the entire case changed in my mind. The report read something like tumor invading the hyperpharyngeal space, glotted and subglotted spaces, with erosive changes into the cricoid cartilage. And I remember staring directly at the computer screen and thinking, this airway is collapsing. And suddenly the room felt completely different. The heart rate stopped mattering so much. Now everybody was looking at the airway. And I remember suddenly feeling very uncomfortable that this patient was still on a regular floor because here's the dangerous part about airway patients. It's the fact that they can look completely fine, completely okay, right until they don't. Still talking, still answering questions, still awake. But now the room had changed. An ICU discussion was held, definitive airway planning, people speaking a little quicker, the subtle shift in energy when people suddenly realize the situation is more dangerous than it looked 5 minutes ago. And honestly, that's one of the hardest parts to explain. unless you've actually worked nights in a hospital, when a room goes from calm to everyone quietly understanding. And now I'm home, and I keep thinking about how calm the room looked before all of this happened. How close someone can be to losing an airway while still answering your questions normally. I don't know. Maybe that's just what stays with you after doing enough night shifts. Learning how often danger whispers before it screams. Hmm. Well, that's my time.